WHO sees low risk of Nipah virus spreading beyond India.
The World Health Organization says the risk of the deadly Nipah virus spreading beyond India remains low, following the confirmation of 2 infections in the country. In a statement issued on Friday, the WHO emphasized that it does not recommend any travel or trade restrictions related to the cases. The reassurance comes amid heightened concern across Asia. Several regional hubs, including Hong Kong, Malaysia, Singapore, Thailand, and Vietnam, have stepped up airport health screening measures this week as a precaution after India reported the new infections. In an email response to Reuters, the WHO said it believes the likelihood of further transmission from the 2 confirmed cases is minimal, noting that India has the medical infrastructure and public health capacity needed to contain such outbreaks. Quote, "There is no evidence at this time of increased human-to-human transmission," the WHO said, adding that it is working closely with Indian health authorities to monitor the situation and assess any potential risks. However, the agency cautioned that additional exposure to the virus cannot be completely ruled out. Nipah virus is known to circulate naturally among fruit bat populations in parts of India and neighboring Bangladesh, making sporadic cases a recurring concern. Nipah is a zoonotic virus carried primarily by fruit bats and, in some cases, livestock such as pigs. In humans, it can cause severe illness, beginning with flu-like symptoms such as fever and headache, and in serious cases, progressing to brain inflammation or encephalitis. The virus is particularly dangerous, with a fatality rate estimated to range between 40 and 75%. There is currently no approved treatment or licensed vaccine for Nipah, although several vaccine candidates are in development and undergoing clinical testing. While the virus can spread from animals to humans through contaminated fruit or direct contact, person-to-person transmission is considered difficult and typically requires prolonged close contact with an infected individual. Health experts say that while Nipah outbreaks can be alarming, they are usually limited in scope. Virologists continue to stress that the overall risk to the general population remains low. The WHO noted that the exact source of the latest infections has not yet been fully determined. Nipah remains classified as a priority pathogen by global health authorities due to its high mortality rate, lack of treatment options, and the potential risk that it could evolve into a more easily transmissible form. The 2 infected individuals, both health workers, were identified in India's eastern state of West Bengal in late December and are currently receiving treatment in hospital, according to local officials. India has experienced sporadic Nipah outbreaks in the past, most notably in the southern state of Kerala, which is considered one of the world's highest-risk regions for the virus. Since Nipah was first detected there in 2018, dozens of deaths have been linked to repeated outbreaks. According to the WHO, the current situation marks India's 7th documented Nipah outbreak and the 3rd in West Bengal. Previous outbreaks in the state occurred in 2001 and 2007, both in districts near the border with Bangladesh, a country that reports Nipah cases almost every year. Health authorities continue to monitor the situation closely, urging vigilance but cautioning against panic as international agencies work to ensure the outbreak remains contained.